Okay, Shane, can I get you to give me a summary on what you found with your assessment on
Yep.
Mrs. Jones?
Sure. Her active range on her left knee was 55 degrees, and on passively it was 70 degrees.
Yep.
She had about a 10 degrees quads lag on the left,
Yep.
and she was 10 degrees off extension on the left as well.
Okay. Now, do we know, is that good for Mrs. Jones?
I'm not too sure.
Is there any way we could find out?
By asking her or reading through her notes and seeing what she was yesterday or the day before.
Yeah, or is there any other way you can tell whether that is normal for her?
Checking the other side.
That would have been helpful, yes. So that's something that we may need to do so that we know what she's aiming towards getting.
Sure.
Okay. Can you tell me a little bit about how her leg looked compared to the other one?
It was still quite swollen compared to the right. It was still probably just sort of the end of a bruise, sort of around most of the knee that was just fading.
Okay. Now, in terms of her swelling, is there any way we could monitor that? Anything we could do that would tell us whether that's improving or getting worse?
Yep. We could perhaps measure around the knee, tape measure, and then monitor that.
Good. Yep. So that's another thing that we can look at doing as well with her. Okay. And what was her strength like? Sorry.
She had about a 10 degrees lag. I didn't actually test it.
Power?
Yeah.
Yep. Okay. So not too bad. What from her assessment findings would you list as her main problems?
Probably her decreased knee range.
Yep.
Which is worse actively. Like we can get a little bit further when we push it, so that sort of suggests that she's probably lost a bit of strength in her quads and the rest of the muscles around there. So decreased strength as well.
Yep.
And she's still got a bit of pain.
Okay. And do we have any idea what's contributing to her lack of range apart from a lack of strength?
Probably just a bit of stiffness, although I didn't really ask her. I didn't really probe into sort of what was stopping her going any further.
Okay, so again, that's probably something that would have been useful to know.
Yep.
So from the things we've found today, what sort of treatment would we look at doing with Mrs. Jones?
Looking doing some sort of range of motion exercises and some strengthening type things, like quads over fulcrum or something like that.
Yep. Okay, good, all right.
There's going to be quite a bit of inflammation and swelling around the structures in the knee, so the swelling could be stiffening it up a bit as just the general sort of trauma that the surgery is causing is going to cause inflammation and that swelling. So.
Yep, good. Okay, so in terms of the knee range, which do you think is more of a problem for her? The fact that she hasn't got full flexion or hasn't got full extension?
I'd say that she hasn't got full extension is more of an issue.
Yeah, and why is that?
Generally need full knee extension to be able to walk in a sort of normal gait pattern.
Yep.
So she's going to be, I'd predict before seeing her walking that she's going to have quite a sort of not symmetrical gait pattern and be not quite right.
Okay, so in terms of her function, you feel that the knee extension is the main thing that needs to be worked on?
Yep.